Good morning. Today I will be giving my presentation on anthrax. Through this presentation you will learn signs, symptoms, prevention, and treatments. Anthrax is an infectious disease of warm-bodied animals, for example, sheep and cattle. It is a gram-positive and rod-shaped bacterium known as Bacillus anthracis. A way anthrax can be transmitted is when humans handle wool and can be characterized by cutaneous ulcerating nodules or often fatal lesions in the lungs. Transmission. Domestic and wild animals, for example, cattle, sheep, goats, antelopes, and deer, they can become infected when they breathe or orally ingest spores contaminated with soil, plants, and water. People who become infected with anthrax contract it when the spores get into the body. When anthrax spores get inside the body, they can be activated. When they become activated, the bacteria will spread through the whole body and produce toxins and cause severe illnesses. They can happen when people breathe in spores by eating, drinking contaminated spores. It can also be contracted through cuts, scrapes, uncommon for people in the United States to contract the disease. It's more common in Europe. So, symptoms with humans. There are 4 common types of anthrax infections. Each different sign has a different symptom. Most cases, symptoms will develop within 6 days of exposure to the bacterium. Cutaneous anthrax, skin-related infection that enters through the skin, usually with a cut or scrape on the top layer. Symptoms include itch, raised bumps, swelling in the sore, and flu-like symptoms. The next one is gastrointestinal anthrax. This infection comes from eating undercooked meat from an infected animal. Symptoms can include nausea, vomiting, abdominal pain, and headache, and fever. Inhalation anthrax. This infection happens obviously when you breathe in any type of spore, and the symptoms will include mild chest discomfort, nausea, and coughing up blood. Now, final one is injection anthrax. This type of infection is found only in Europe. It is contracted through injecting illegal drugs. Symptoms can include redness of area injection, significant swelling, shock, and multiple organ failures. Now, the symptoms with the symptom with animals. The signs and symptoms with animals appear within 3 to 7 days after the spores are swallowed or inhaled. Once signs in animals begin, they usually die within 2 days. Infected animals have these symptoms: difficulty breathing and tremble. Then after that, the animal will collapse and die within just a few hours. So the treatments. Humans with anthrax will be treated through antibiotics. The antibiotic names are penicillin, doxycycline, and ciprofloxacin. Inhalation, though, is treated with more medicine, including a higher dose of the ciprofloxacin and an IV. Anthrax with animals are more susceptible to antibiotics, so prompt treatment animals at the earliest signs should be effective, but the treatment with antibiotics will counteract vaccinations, so you should not, sadly, vaccinate them for anthrax if they are experiencing those symptoms, if they were just recently vaccinated. The prognosis in herbivores, which will include horses, chickens, cows, sheep, goats, pigs, etc. In herbivores, anthrax commonly presents as an acute septicemia with a high fatality rate, often accompanied by hemorrhagic lymphatics. In dogs, people, horses, and pigs, it is usually less acute, but is still very fatal. Prevention. In humans, antibiotics can prevent anthrax from developing if you have just been exposed, but have not developed symptoms. Yet they offer small protection. Other ways include safe workplace habits. including wearing your ventilated or working in ventilated workspaces, wearing your protective gear, and the most importantly, washing your hands after handling any type of animal. For animals, the best way to prevent them is through vaccination after consulting your veterinarian. In conclusion, I think anthrax is a disease that no animal or human should come in contact with, like many of these other diseases that my fellow students are talking about. I know how serious it can be now, especially with living on a farm. There are always the scary factors of, am I doing what I am doing right? Am I doing everything good for them, including myself? So for my final point, I would like to make it, when you visit any type of farm or zoo even, just wash your hands, because that is a way that you can be doing your part. Thank you.